I've opened thousands of chests. I've held living human hearts in my hands, felt them beating, struggling, giving out. And I'll tell you something your GP will probably never say out loud. Not because they don't care, but because the system won't allow it. Most people on blood pressure medication are not getting better. They're getting a better number on the machine. Not the same thing. The damage inside their arteries keeps going every single day, quietly. Nobody told them there was another way. Today I'm changing that. I want to show you what's happening inside your vessels right now and what you can actually do about it. When was the last time your doctor explained why your blood pressure is high, not handed you a prescription, actually explained the mechanism? I'm guessing the answer is never, and I'm not here to criticize your doctor. The system is the problem, not the person. The medical system gives a doctor 7 minutes per patient. 7. You cannot explain arterial biology in 7 minutes, so they give you the simplified version. The plumbing story. Too much fluid, pipes too narrow, one drug widens them, another reduces fluid. Numbers come down, problem solved, except it isn't. That model is dangerously incomplete for anyone over 60. After 60, your arteries are not just narrow. They are structurally damaged in ways no blood pressure pill even comes close to addressing. The walls have changed. The tissue has changed. The chemistry has shifted in ways that medications simply cannot reach. Think of a kitchen pipe, cracked, corroded, coated in mineral buildup inside. Turn down the water pressure, the reading improves. Did you fix the pipe? Did the cracks heal? Did the mineral deposits dissolve? Of course not. The pipe is still failing. That is exactly what standard blood pressure treatment does. It manages the reading. The structural damage underneath keeps getting worse. I've seen those vessels with my own hands. The difference between an artery that has been treated and one that has been healed, they look nothing alike. 3 hidden mechanisms destroying your vessels, and a 4-step protocol that addresses the root, not the symptom, not the reading, the actual structural damage underneath. Are you ready? Because this changes the way you'll think about your health permanently. Something that doesn't get taught in health classes. Something most cardiologists never explain to their patients. Every blood vessel in your body is lined with the microscopic protective layer. It's called the glycoalix. Most people have never heard of it. This invisible layer is one of the most important structures in your cardiovascular system, and almost no one over 60 has been told it exists. Think of it as a Teflon lining inside every artery, thinner than a human hair, essential to how your vessels function. It keeps blood flowing smoothly, prevents clotting, signals arteries to relax under pressure, and blocks inflammatory particles from penetrating vessel walls. Healthy glycoalix, healthy arteries, damaged glycoalix, and you've opened the door to plaque, stiffness, elevated pressure. It all starts here. What destroys it? 3 specific things. If you're over 60, all 3 are almost certainly already at work inside your vessels. Number 1, elevated blood sugar, even mildly elevated, not diabetic levels, just chronically higher than ideal. The kind of doctor might not even flag. At the molecular level, sugar is sharp. Elevated glucose shreds glycoalix tissue the way sandpaper damages a painted surface slowly, visibly, relentlessly. Number 2, chronic low-grade inflammation. No fever, no pain. A constant background burn inside your vessels and you'd never know from the outside. Processed foods, disrupted sleep, excess body fat all fuel this ongoing fire that silently degrades your vascular lining every day. Number 3, oxidative stress. Free radicals rust your glycoalix from the inside. After 60, your body's natural antioxidant defenses weaken significantly. Once that protective lining breaks down, vessel walls become exposed, inflammatory particles penetrate, plaque accumulates. The artery narrows and stiffens over time. Your blood pressure rises, not from last Tuesday's dinner because your vascular structure has been quietly eroding for years, possibly decades. How many of those 3 causes does a standard blood pressure pill address? Blood sugar damage? No. Inflammation? No. Oxidative stress? No. The answer is 0. Your vessels keep deteriorating. The pill simply masks the pressure result. Now let's talk about what happens next. Second hidden mechanism. Once glycoalix breaks down and vessel walls become inflamed, your body recognizes this as damaged and tries to repair it. One of the repair strategies it uses, particularly past 50, is depositing calcium directly inside the arterial wall itself. The same calcium recommended for bone health. Your body starts placing it in entirely the wrong location, inside your arteries. More than 90% of men over 65 show measurable arterial calcification on imaging scans. For women, nearly 80%. Young arteries are elastic. Each heartbeat causes a slight stretch that absorbs the pressure wave, then recoils to push blood forward smoothly. Calcified arteries can't stretch at all, rigid, closer to concrete than rubber. Every heartbeat slams a pressure wave against walls that cannot absorb it. Your systolic number spikes dramatically with each beat, not from excess fluid, from walls that have lost the ability to flex. You know what arterial calcification feels like? Nothing at all until the consequences arrive. Suddenly, seriously, without warning. Think about someone whose top blood pressure number keeps climbing despite following all the usual advice. Cutting salt, taking medication, doing everything right. That pattern almost always means arterial stiffness, calcium in the walls, something standard medications are not designed to touch. Standard medications do not remove calcium from arterial walls. Not one of them. The calcium stays, the rigidity stays, the structural damage continues. But there is a specific nutrient shown in clinical research to redirect misplaced calcium out of vessel walls and back toward bones where it belongs. I'll explain the exact mechanism in the protocol. But first, the third hidden mechanism, the one that surprises people the most. Excess sugar is damaging, but the mechanism causing the most harm isn't sugar. It's what your body produces in response, insulin. When insulin stays chronically elevated, even modestly, something specific happens inside your kidneys that most doctors never connect to blood pressure. Your kidneys receive a signal: hold on to sodium, do not excrete it, and they follow that instruction continuously around the clock, regardless of how little salt you eat. This explains why so many low-sodium diets barely move blood pressure numbers at all. The problem was never your salt shaker. It's insulin signaling your kidneys to retain sodium independent of anything on your plate. Elevated sodium retention increases fluid volume in the bloodstream. More fluid, more pressure against walls already damaged and stiffened. Three systems failing simultaneously. Glycolytics destroyed, walls calcified, insulin-driven fluid pressure from inside. Something eventually gives. And here's what makes this particularly cruel after 60. Insulin sensitivity declines naturally with age. Even in people who eat well and stay active, a person at 65 may have significantly higher baseline insulin than at 45. Eating the same diet, the biology just shifts. Almost nobody discusses this in the context of blood pressure. It's one of the most important pieces of the puzzle that's been missing from your care. Does your blood pressure medication lower your baseline insulin? Does it reset your kidney sodium retention signal? No, not at all. You're reducing pressure in a pipe that keeps corroding while the signal telling kidneys to hold fluid keeps firing every single minute. Three mechanisms: glycolytics destruction, arterial calcification, insulin-driven sodium retention, all running simultaneously, all completely untouched by standard treatment. But each mechanism has a targeted, evidence-based response, and none require abandoning your current medication to begin. These 4 steps work alongside your treatment, not instead of it. You and your doctor work together with monitoring, with supervision. This is about going after the structural damage, the corroded pipe, not just managing the pressure inside while the corrosion continues. Are you ready for the protocol? What comes next is what I wish every person over 60 with the blood pressure diagnosis could hear. Step 1. Rebuild the glycolytics. The most important good news in this video: the glycolytics can regenerate. Your body knows how to rebuild it. You just need to stop attacking it and start actively supporting it with the right inputs. Most powerful first move: stabilize blood sugar, not through extreme restriction. Consistent reduction of foods that spike glucose the fastest. White bread, white rice, pastries, sweetened drinks all create spikes that directly damage glycolytics tissue with every meal that contains them. Replace them with whole grains, legumes, vegetables, lean protein. A consistent shift, not an overhaul. Vessel lining responds within weeks. Second, polyphenols, dark berries, leafy greens, olive oil, dark chocolate, over 70% cacao, structural support for your arterial walls. Polyphenols target oxidative stress directly. The third, glycolytics destroyer we covered. They act as a repair crew for your vessel lining. Research showed consistent polyphenol intake improve vessel lining function, what we call endothelial health, in as little as 4 weeks. 4 weeks. A handful of blueberries, a cup of spinach, quality olive oil, not just healthy food, structural repair. Third, marine algae compounds show clinical promise in direct glycolytics regeneration, fucoidin and rhamnin sulfate. These are backed by peer-reviewed studies, not marketing. Worth a specific conversation with your physician. Start with the food. Less refined carbohydrate, more polyphenol-rich plant food. That shift alone creates meaningful vascular changes within weeks, not months. Step 2. Decalcifying your arteries. I need to be transparent about something before I explain this. In medical school, arterial calcification was presented as a one-way street. Once calcium deposits in vessel walls, it stays. That was the consensus. Research from the last 15 years is seriously challenging that position. What we now understand changes the clinical approach significantly. Calcium doesn't deposit randomly. It accumulates when a key regulatory protein is inactive, and that protein requires one specific nutrient. That protein is matrix GLA protein. It prevents calcium from depositing in soft tissue, but only if supplied with vitamin K2, not K1, the form and leafy greens involved in clotting. K2 specifically. Most adults over 60 are significantly deficient. K2 is found in natto, aged hard cheeses, and grass-fed animal products. Foods most Western diets include in only trace amounts. When K2 is active, matrix GLA protein pulls calcium away from arterial walls and redirects it to a bone where it actually belongs. The Rotterdam study tracked over 4,000 adults for 10 years. Higher K2 intake linked to significantly less calcification and lower cardiovascular mortality. 4,000 adults, 10 years, major longitudinal data showing measurable structural outcomes from this single nutrient. That is not a small finding. K2 works best combined with vitamin D3, which governs calcium absorption and magnesium in a well-absorbed form, not the magnesium oxide form in most pharmacies. Very poorly absorbed. Glycinate and threonate forms reach the tissues that actually need them. This trio, K2, D3, and absorbable magnesium, works at the arterial wall itself at the actual calcium, not the pressure reading above it. Talk to your physician before starting. Ask specifically about your vitamin D and magnesium status. Most people over 60 are deficient in both. Step 3. This one consistently surprises people because it's so simple and the research behind it is genuinely impressive. Nitric oxide produced by cells lining your vessel walls. When levels are healthy, arteries dilate, pressure drops, your body's own built-in regulator. The problem production falls sharply with age. By 65, most people make roughly half the nitric oxide they produced at 30, and damaged glycolytic tissue from step 1 produces even less. A double blow that compounds the pressure problem significantly. 2 research-backed methods to restore it naturally, both surprisingly simple. The first, isometric grip training, a grip strengthener a few dollars, squeeze and hold 2 minutes, rest 2 minutes, repeat 4 times, 3 sessions per week. A meta-analysis in the British Journal of Sports Medicine found this reduced systolic blood pressure by an average of 8 points. 8 points that rivals the effect of some medications from a rubber device in 24 minutes of effort per week. The mechanism sustained muscle contraction triggers a direct burst of nitric oxide released from vessel wall cells. Measurable, reproducible, documented. Second method costs nothing, no equipment, and most people dismiss it as too simple to matter, which is exactly why they miss it. Breathe through your nose consistently throughout the day and during sleep. Your nasal passages synthesize nitric oxide with every breath through them. Mouth breathing bypasses this entirely. Every breath through an open mouth is a missed nitric oxide delivery. Most people over 60 have been doing this for decades. Start tonight. Takes 2 weeks to feel natural. The physiological benefit begins with your very first deliberate nasal breath. Step 4. Clinically the most systemically powerful of all 4. Reset your insulin. Unlock your kidneys. When you lower chronic baseline insulin, kidneys stop retaining excess sodium, fluid volume decreases, pressure eases from inside without medication. 2 tools, both backed by substantial evidence, intermittent fasting and progressive resistance training. Used together, they are remarkably effective. Intermittent fasting, the 168 protocol. You eat within an 8-hour window, you fast for 16, mostly overlapping with sleep. During the fasting period, insulin falls to its physiological baseline. Kidneys get a prolonged break from the sodium retention signal. I know what some of you are thinking. Doctor, I'm 67 years old. Fasting sounds extreme. I actually need to eat. This is not starvation. You eat the same amount of food just within a shorter window. Same calories, same nutrition, different timing. Many patients over 60 find it far easier than expected. Simply delay breakfast. First meal at noon, last at 8. That's the entire change. If 16 hours feels too ambitious, begin with 12. The insulin response starts shifting within 3 or 5 days of consistent practice. Second tool, resistance training. Before you mention your knees or your back, I'm talking about body weight work, not gym equipment. Chair, sit to stands, wall push-ups, light resistance bands from a seated position, 10 to 15 minutes, 3 times per week. A study from the Journal of Applied Physiology found 12 weeks of this reduced fasting insulin by 25% in adults over 60. 25%. Without changing diet at all. Combine fasting with gentle resistance training and you address the insulin-kidney lock directly. I need to stop here and say something very carefully before anyone misinterprets what this protocol is and isn't. Everything I've described, the glycoalix, the calcification, the insulin-kidney mechanism, this is not fringe medicine, not alternative theory. Every mechanism I've walked you through appears in peer-reviewed medical literature read and cited by cardiologists and surgeons regularly. So why isn't your doctor doing this with you? Honest answer, it's structural, built into how the system is designed and incentivized. A medication taken every day for 30 years generates 30 years of prescriptions. Structural arterial healing is a very different economic equation. I'm not claiming conspiracy. I'm pointing out that the system's incentives are not aligned with arterial healing. They're aligned with chronic disease management. And here's what makes this genuinely urgent. Arterial damage is cumulative. Every year, without addressing root causes, calcification deepens, glycol extends further. The window for meaningful reversal is real, but it is not permanently open. Each year, without structural intervention, narrows it a little further. For most adults over 60, not yet at end-stage cardiovascular disease, that window is still open right now. I've seen this with my own patients in their late 60s with documented improvements in arterial elasticity on imaging. Not just better readings, but measurably more flexible artery. People reducing medication under physician supervision. Doctors looking at follow-up imaging saying, "What did you change?" Because something is clearly different. That is real. It is possible. And it begins with understanding what is actually wrong, not just managing the number on the cuff. So here's the summary. 4 steps. Real mechanisms. Structural repair. Step 1. Cut refined carbs. Add polyphenol-rich foods daily. Discuss marine algae compounds with your physician. Step 2. Request testing for vitamin D and magnesium. Discuss K2, D3, and absorbable magnesium with your doctor at your next visit. Step 3. Grip strengthener 3 times weekly. Breathe through your nose, especially at night. Start this week. Cost is essentially zero. Step 4. Begin with a 12-hour eating window and body weight exercise 3 times weekly. Give it 12 full weeks. None of this replaces your medication. Do not reduce or stop any prescribed drug without direct physician supervision. Your doctor monitors your readings as these changes take effect. Over time, with proper oversight, some people find they need less medication. But that decision is always made together with your physician based on monitored data, not alone based on the video. Here is my question for you. Of these 4 steps, which one feels genuinely achievable to begin this week? Tell me in the comments. I read every single comment. Your answer might help someone else watching this wondering exactly where to start. If this changed how you think about blood pressure, share it with someone you care about, a spouse, a sibling, a friend on medication for years. I'm Dr. Clarence Martin. Take care of your arteries. They've worked for you every day. Everything here is general information. Always consult your physician before making changes.